Alrighty, good evening, everyone. So this is chapter 14 of the Psychology second edition textbook. And tonight we're going to be looking at stress, lifestyle, and health. Actually, we'll focus a lot on stress, as we were just talking before the class started. You guys are doing an 8-week course, which is really designed, I normally do this in 16 weeks. So we're cramming a lot of material in. And yeah, so that could be a lot of pressure, and I totally get that. So, and by the way, you guys have been doing great, participating and getting your assignments done. So you appear to be managing your stress well. So anyway, congratulations on that. So tonight, this is what we're going to be talking about. We're going to be talking about the physiological features and the psychological features of stress. We're going to talk about some causes and consequences and some stress management techniques. So that's part of our goals for this evening. And in this next section, these are the topics we're going to be covering. And, it's interesting, good stress. I wonder how anybody ever heard of like good stress or Eustress before taking this course? I'm just kind of curious. Anybody hear of that before?
Yes.
Oh, nice. One person. Hopefully more, and certainly now, everybody, when we get to that part. So let's talk about what stress is. On this particular slide, we're looking at a loose definition, and on the next slide, it'll be a little bit more clinical. But stress is loosely defined, right, as unpleasant feeling states, right? So I'm feeling pressure, I'm feeling frustrated, I'm feeling conflicted or overwhelmed, and these are just very unpleasant. They can make us so that we're a little bit more irritable, we're short with people, and as we'll see a little bit later on, stress can result in health problems, health complications, right? And so we want to look at two definitions right here regarding stress, right? So first, there's the stimulus-based definition, right? And this is when we're looking at stress that is demanding or threatening. There's an event, there's some kind of situation that is occurring, right? And the example that's used here is a high stress job. And in a high stress job, there you might have scheduling demands, surprises, like I'll give you an example. So like where the job that I do, and for those of you that will be looking to do like alcohol and drug counseling or mental health counseling or moving into those human services type of things, yes, you can schedule appointments, but there's also those unscheduled crises that can happen, right? That might mess up your schedule. That could be stress. But this definition characterizes stress as a stimulus that causes certain reactions. So in other words, something happens and then I react to it, right? But it fails to recognize that different people, view and react to stress or challenging situations differently, right? And then, a little bit later on, we're going to talk about learned helplessness. There's also the concept of resiliency. So you might have two people encountering the same situation, and one is affected or impacted greater than another, right? And so those are situations that we look at. And then there's the response-based definition of stress, which emphasizes our psychological responses that occur in response to, let's say, the high stress job, right? And this is basically characterizing stress as a response to our environmental conditions, right? But neither one of these, and as I said at the beginning of this slide, we're kind of looking at this loosely, and the next slide we'll drill down on it a little bit more. But neither one of these provide like a complete definition of stress. Now they kind of make sense. I think they're very understandable, but let's move in and drill deeper. So the definition of stress that I want you guys to know is a process whereby an individual perceives and responds to events he appraises or she appraises as overwhelming or threatening to their well-being. And what's important here, what I want you guys to think about here is actually the word appraisal, right? It's how are we judging the situation? And it is that appraisal that influences our reaction. And there's a couple of different types of appraisals. So first we have primary appraisal. And that's basically the judgment to the degree of what is the harm or threat, right? How bad could it be? And that's broken down into two things, right? It's either a threat or a challenge. So a threat is a stressor that could actually lead to, maybe physical harm, loss, or some type of like negative consequence. So that would be a threat. A challenge is the stressor that carries the potential for personal growth or some kind of gain in one's life. Hold on one second. It looks like I got a chat. Let me just double check that. Okay, no worries. I got your message. So you're good. So for example, getting back to the threat versus challenge thing. So graduating from college and entering the workforce can be that same event can be viewed in two different ways, right? So one way it can be viewed is as loss of financial support. Maybe you're, moving out of your parents' place, or maybe the job that you want, that you've been trying to get, you can't, or that you went to school for, maybe isn't available as quickly as you thought, right? So you might not be making as much money. So that could be viewed as a threat when we think about our finances. The other side of it is it can be viewed as a challenge, right? So this is an opportunity for independence and growth. So depending on how the person is viewing it, because both things could really be happening, right? And then there's secondary appraisal, and that is the judgment of the options that are available to me. So if I view something as a threat or a challenge, then, well, if it's a challenge, you'll see on the next slide, maybe we should just go to the next slide because it kind of gives a nice breakdown, right? So here's the stress in, the stressor. And let's just use the example of the college, graduating from college. So I'm graduating from college, that's the stressor, right? It's either a threat or a challenge. And that's based on how what's my primary appraisal? How am I viewing it? And if I view it as a challenge, no, this is great. I have lots of potential to grow here. This is going to make me a better person, yada, 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 whatever it happens to be, right? You'll see that it kind of ends there. There's not a whole lot that a person would need to worry about there. There's no secondary appraisal at this point. But with a threat, that's a little bit different. So you see that if the primary appraisal views the situation as a threat, which may lead to harm, loss, or negative consequences, as the definition described in the previous slide and on this slide, then we go into what's known as secondary appraisal. And this is where we're looking at our options. So what are my options? How effective are my options? In other words, do I think they're going to work? And if I believe that my options are effective, then it's a low threat, right? If I believe that I have either no options at all, or that the options that are available to me are ineffective, then that would be deemed as a high threat in secondary appraisal. All right, looks like we got another, oh, hold on one second. Turn off my highlighter. Sorry about that. Whenever I have the, it's still on. Whenever I have the highlighter on, the mouse doesn't want to work correctly, so pardon my technical thing here. All right, no worries. I hope you feel better. Just responding to a chat verbally. All right. Any questions on primary appraisal, threat, challenge, or secondary appraisal? Seems pretty straightforward, but you will want to be careful on the exam, to make sure, because I've seen this before where primary and secondary appraisal, sometimes people will get them backwards. So I highly recommend, reviewing the chart and kind of knowing what the question is actually asking for. All right, so now let's talk about good stress or bad stress, right? So eustress is the stress that can be positive. It can motivate us to do things that are in our own interests, in our best interests, and they're generally associated with positive feelings, optimal health, performance, right? So an example, anybody got an example of eustress? I have one I'm thinking of, but wanted to see if anybody had one. What might be an example of eustress, a positive and motivating situation? All right, I'll throw in mine. Oh, what's that? Go ahead.
Like when you're working and you just finish, like I work in a school and I'm just waiting for the vacation and the summer's over because yeah, I want to go out of the school.
Okay. Oh, so you're kind of, all right. Well, yeah, that could be. I'm wondering if you're also kind of experiencing some distress there, right? Like, I'm not sure. Yeah, I was thinking of, my example would be like buying a house or maybe buying a new car, right? That might be an example of eustress, right? It can be stressful. And but it's for more positive things, right? And yeah, that's one thing. Applying just for school or getting your financial aid lined up can be stressful. You got all these forms to fill out, but it can be it can still be stressful, but it's considered more positive, like I'm doing something. Generally, people feel like, okay, I'm making progress. Another chat that came in, it's like performance related stress, like acting in a play. That might be another very good example, right? So if you're studying your lines and you get selected for the part, you could be experiencing eustress, right? Can be going to experience that positive feelings. You also might be a little nervous, but the positivity is going to outweigh that, right? And it's probably going to motivate you to do a really, really good job. And you'll notice here in the chart, and okay, and then there's distress. I think that's a lot of people could probably easier identify distress, like Miss Betty with the school example. I don't want to make any assumptions, but I'll just speak for myself. Like, I look forward to my vacation, and during and up until that time, I might be experiencing some eustress. I get my stuff done. Sometimes though, coming back from vacation, Sometimes I need a vacation from my vacation. I get back and I've got all these emails to respond to. I've got, you know, appointments to book, and, you know, and that can be, you know, that can be exhausting. So, any other examples anyone wants to
I feel
kind of
related with you, because when I was on vacation, I have to be on time to get your classes. I said, oh my God, I was so stressful to not be absent on your class.
yeah. So in other words, what I'm hearing is that I caused you a little distress.
Yes, a little bit.
Yeah, that's all good. So, and maybe a little bit later on when we get to coping, you could share with us how you kind of worked through that, because that is also an important part of this. And we haven't gotten to it yet, right? Because when it comes to distress, this is where people feel burned out, fatigued, exhausted, and your performance actually declines. I'm going to turn on the highlighter here, the laser pointer. And, you know, if you'll remember back to other performance, when we were talking about optimal performance, oh shoot, it's on the tip of my tongue and the chapter just went out of my head. But you'll remember there was a bell curve, right? And that there was an optimal level of performance. It was the Yerkes-Dodson bell curve that we were talking about, right? And it's the same thing with stress. When a person is experiencing eustress, in other words, the positive feelings, that tends to build to a point where this is the optimal level of performance, right? But once it crosses that line and the eustress is no longer there, but now it's distress, then your performance level, as you can see from the bell curve, is going to drop. And that's the other issue with distress, with burnout. And by the way, burnout is one of those things that I talk to other counselors about all the time. In the helping profession, you know, helpers can experience burnout, and so really need to be careful of that. And really, we have an ethical responsibility for self-care. First of all, it's good for us anyway. But really, if you think about this, if I'm helping another human being, I have an ethical responsibility to engage in self-care so that I'm not experiencing the distress, the burnout. Because if my performance, if I'm fatigued, if that declines, then that's going to adversely impact my client, isn't it? Let's see. All right. Yes, Betty, I got that. Save that for when we come to the coping part, but I liked what you wrote. All right. All right, so let's talk about the stress. Now, this chart is from 2013. It was in the first edition of Psychology, and it's in the second edition. I did not get a chance to look up and see if there has been any more recent studies on this, but 2013 is, 8 years ago. So, and by the way, when you're looking at research, usually it's best to look at research that is well, depending on what it is, but you want to try to get the most recent research, and within 10 years, which is what I usually recommend people when they're doing research papers, look at that stuff. Unless, of course, you're looking at things like the marshmallow experiment and other stuff, some of the older ones. But so this is 8 years old, and you'll notice that according to the chart, nearly half of all Americans, right, indicated that their stress levels have increased over the past 5 years. So we would be talking from 2008 to 2013. I'm curious how you guys have experienced stress from 2013 to, let's say, now, right, over the past 8 years. Would you say it has increased? Or has it decreased? Or has it remained the same? Let's see. So let's talk about the issues that come with stress, right? Earlier, I talked about physiological harm, to our health, things like this, right? So physiologically, it increases our heart rate, blood pressure, headaches, GI problems, right? Feel sick to your stomach, you're kind of just feel kind of blah. Cognitively, we have difficulty focusing, paying attention, making decisions, right? We have difficulty concentrating. And then behaviorally, this is where someone may increase their consumption of alcohol. During this pandemic, right? There's lots of reports. I haven't seen any studies on it per se, but there's been lots of reports that people are consuming more alcohol. We know that the overdose rate has dramatically increased in 2020 over 2019, right? So behaviorally, people are dealing with the pandemic, stressors, lockdowns, isolation, with some kind of substance use, right? The other thing that behaviorally people do, and in my profession, I work with individuals with substance use disorders, right? And so what they're doing is their behavior really is directed at eliminating the feeling of the stress, right? So they kind of want to avoid the feeling, right? The other things behaviorally that people can do is they can take actions that actually are directed at eliminating the cause of the stress. So they might change their job, for example, if that becomes necessary, as one example. All right. So let's talk about Walter Cannon. And you guys will recognize the fight or flight response. And remember, fight or flight, that is, part of our sympathetic nervous system response. It's designed to get us ready to either flee a threatening situation or to fight, right? To protect ourselves in a threatening situation. And this is where the problems with stress come in. If you have an individual that is constantly experiencing high amounts of stress, the body is really going to stay in that fight or flight kind of response, always on edge, always teed up, right? So, but Walter Cannon, he was the first to identify the body's physiological response. And then he is also the one that coined the phrase fight or flight. You will want to remember, his name and the connection to fight or flight. We'll also talk about fight or flight right here. So this is also similar to one when we were looking at the biopsychology chapter 3, and we were talking about the central nervous system and the peripheral and the different systems, and we were introduced originally to fight or flight response. And I know we talked about this during chapter 3, right? But one of the things is, the pupils dilate, your heart rate increases, your muscles become tense, right? Your bronchial tubes are going to dilate. In other words, they're going to become larger. And the reason for that is, the pupils are dilating because so that you can take in more visual information. Your heart rate increases, to pump the blood, right? Oxygenated blood to your muscles. And your bronchial tubes are dilating to take in more oxygen, right? For that oxygen blood exchange. And all this is designed to get the body ready to go. This is when your adrenal glands are releasing, adrenaline and noradrenaline, or epinephrine, norepinephrine. And then that's what is causing these physiological changes in the moment. Who remembers what is the response, not the sympathetic nervous system, but what's the other one that calms the body down? Who remembers?
Parasympathetic.
That is correct, right? So the sympathetic, that's your fight or flight. And then your parasympathetic, that's what's calming you down, bringing you back to your regular routine activities. That's correct. All right, so Hans, and you do not pronounce the L in this, it's actually pronounced Seye. He specialized in research surrounding stress, and he came up with the idea of what's known as the general adaptation syndrome. And what he said that when we're engaged in these stressful situations, right, our body goes through, there are 3 stages to the general adaptation syndrome. First, there's the alarm stage, right? So that's when when it first happens, and it's your body's immediate reaction, right? That sympathetic nervous system response, fight or flight. And it's designed, obviously, like we've already been talking, I'm going to repeat myself again. It's designed to provide energy so that you can manage that situation. So you can either flee or stand and fight to defend yourself. Then there's the resistance stage. And this is where if the stressor is continuing, then the body adapts to the stressor, but remains on alert. So I'm going to remind you of some terms that we learned, homeostasis versus allostasis when we were talking about substance use, right? And if you kind of look at this, the resistance stage, if I'm continuing, and by the way, putting a drug into my body is also considered a stressor on the body, right? Your body actually adapts to that and goes into that allostatic load. What he's saying here is that the body actually adapts to the stressor, and it remains at a heightened sense of alert, but your reactions are actually beginning to diminish, right? So it starts to have a negative effect there. And then stage 3, which is the exhaustion stage, is when you're wore out, basically. You can no longer adapt to the stressor. Your physical resources are depleted. It's taking wear and tear on your body, and this is where the risk of illness, disease, heart disease being one of those that we'll talk about in a little bit, that's at high risk for this, and then death. And here's an example of a chart of his adaptation syndrome. And so you'll notice, let me see, let me turn on the laser pointer. So on this axis, you have stress resistance. And on this axis, obviously, over time. And so in the alarm reaction, you'll see there's like a little dump and then it comes up. And this is the area in the resistance phase where you'll notice, see there's an increase here, but it kind of starts to curve down. And then you're in your exhaustion phase. And then this is where, again, for continued exhaustion or prolonged stress, this is where we're beginning to risk the onset of illness, disease, or other things that may result in a person's eventual death. Right, so that's kind of what it looks like. Chart it out. Let me turn off my laser pointer. All right, so let's talk about physiological basis. Actually, we've already been talking a lot about it. What we have not talked about yet is we've already talked about the sympathetic nervous system. And now we're going to talk about the hypothalamic, pituitary, adrenal axis. You can just say HPA for short, right? So the hypothalamus, the pituitary gland, and the adrenal glands. And so what happens is the stress occurs, then the hypothalamus releases the cortisol. I always mispronounce this. Cortisotrophin releasing factor. It's a hormone, and basically this hormone is telling the pituitary gland to release ACTH, and that in turn activates the adrenal glands, and then the adrenal glands release hormones, including cortisol. And you may have heard of cortisol. Cortisol is that stress hormone that provides the boost of energy that we first encounter when we are experiencing a stressor or what we perceive as a threat, right? So it puts us into that fight or flight, right? The problem here is with continued stressors, right? The continuous levels of cortisol weaken your immune system. And this is where the onset of illness comes in. So the more stressed you are for the longer period of time, you may find that you're catching colds more. That you're at the minimal end, right? Colds and flus, you might be sicker more. You're experiencing those GI problems like we talked about before. But then you also, right, you're at increased risk of high blood pressure, accelerated heart rate, and now we're moving into, heart disease territory, etc. Right? So it's the HPA axis that kind of triggers that, right? So it moves from the hypothalamus to the pituitary gland to the adrenal glands. All right, any questions on that before we move on to stressors?
Professor, when people start losing the hair or lack of sleep and everything is in this stage, right?
Well, so losing hair, like that could be genetic as well as stress. Yeah, so sleep disturbance can definitely be a sign of prolonged stress as well, right? Yes. Although losing, I always make the joke, I want to pull my hair out. So yeah, the hair falling out, I'm not exactly sure, so I don't really want to say. But sleep disturbance can definitely be linked to stress as well, right? Because then your mind might not be shutting off either. Constantly thinking about your stressors. And speaking of stressors, we're going to talk about several, right? Traumatic events, life changes, hassles, that kind of stuff. All right, so stressors. So we have chronic stressors, and then we have acute stressors. And chronic stressors are those that persist over an extended period of time, right? So for example, the pandemic. Lots of people have been experiencing chronic stressors, right? Especially if you're worried about being evicted, right? And you're behind in your rent. You've been unemployed. That long-term stuff is what I think about when we're talking about chronic stressors. When it comes to acute stressors, that's brief. Sometimes can be intense also, right? But can still be overwhelming even after falling and breaking a leg, right? As for an example. So the reason, well, I actually got tongue-tied on that because I had a memory of a friend of mine. We went hiking over on Coles Mountain. And I don't know if you guys have ever done hiking around here, but there's lots of great places to hike. But he fell and broke his leg. And we were on the top, and he had to be like airlifted out. Even after that, so that was his acute stressor, using that as an example. But even after that, he had broken his leg so badly that he needed surgery, pins, right? He was stuck at home for a long time. So the acute stressor was continued for him to be overwhelming even after the fact. And so that's one example that I could think of. And then the other types of stressors that I want to kind of talk about here too are traumatic events. So it used to be, way back, well, let's say World War I, before there was the term post-traumatic stress, right? As a result of injury to, not injury, as a result of participating in, military combat, right? Being severely injured or whatever the case may be, or your friends dying around you or being severely injured. And they used to call that shell shock way back in the day. And of course, now we recognize it as post-traumatic stress. And for a long time, whenever people thought of post-traumatic stress, they really associated it with the military, which is true. They're definitely experiencing that post-traumatic stress. And by the way, you may notice that I'm just using the words post-traumatic stress as opposed to post-traumatic stress disorder. Post-traumatic stress disorder is the correct diagnosis, but I've worked with veterans in the past that have experienced that, and they really don't like the term disorder. So usually when I'm verbalizing it or talking about it, I will usually drop the term disorder. But of course, on any official documentation or diagnosis that I would make, I would have to spell it out with the proper codes and all that kind of stuff. But so I just kind of want to explain why I'm not using the full term. But post-traumatic stress can also occur. Let's say you are, I'll give you a perfect example. You remember when we watched the video of picking cotton, right? So, and she had been subjected to a rape. Now she talked about some post-traumatic. She didn't really talk about it too much in detail, but if I just know that she experienced some of that post-traumatic stress. If you were physically attacked, or robbed at gunpoint, or these kinds of threatened or actual physical assaults are also traumatic events. Terrorist attacks, natural disasters, for example, surviving an earthquake or a hurricane. And then of course, car accidents. I think I shared with you guys at the beginning of the semester that, I do some EMDR work, and one of the clients that I worked with EMDR, it was involving a car accident, and he had not, because of that car accident, he was experiencing post-traumatic stress. The thought of getting behind the wheel, he would freeze. He avoided driving. He hadn't driven in 8 or 10 years. And so he was experiencing, symptoms of post-traumatic stress, or, from these traumatic events. Now, let me ask you guys a question. Of this list here, what do you guys think is most likely to cause someone to actually go on to experience post-traumatic stress? I mean, everyone here can experience it, right? But what's the highest risk factors, do you guys think?
Military combat?
Yeah, military combat, definitely. And what would be next?
I'm gonna say threatened actual physical assault, physical attacks.
Yep.
Yeah.
Yes, that would be next. Any other thoughts?
Natural disasters.
Yep. And I will tell you that I forget the name of the research article now, but after Hurricane Katrina, about 21% of the people that survived that actually went on to develop post-traumatic stress symptoms a year out from that, right? So yes, absolutely, definitely. And of course, car accidents. Yeah, go ahead.
Let me ask you a question right quick. You got terrorist attack on here. Would January 6th count as a terrorist attack? I'm just saying. I mean, there got to be a report somewhere because people have to ask stuff.
That's a very good point. So So as a clinician, I would be looking at, like, if I was treating, let's say, one of the police officers, for example, I would definitely be looking at that like a terrorist attack. I would also be looking at it as threatened actual physical assaults. And if you think about it, and sadly, just this past week, 2 more police officers who were involved in January 6th committed suicide. Now, we're not going to talk about suicide in this chapter. We're going to talk about suicide in the next chapter, and I may bring it up again. But post-traumatic stress symptoms can make a person at higher risk for suicide. And there's other factors too, and we'll go over those other factors. But yes, I absolutely would consider that under bullet point number 2 or number 3, right? Threatened actual physical assaults or a terrorist attack. That, there was a mob of well over 1,000 people that stormed the Capitol, right? And there was a lot of violence that happened that day. So absolutely. All right. Any other questions on chronic stressors, acute stressors, traumatic events? Oh, the other thing I do want to say about PTSD or post-traumatic stress, one of the criteria in order to be diagnosed with post-traumatic stress, criterion A in the Diagnostic and Statistical Manual, which actually we're going to talk about in the next chapter, so we'll talk about it on Monday. Criterion A is one of these things has had to have happened to the person. So, so if a person has not actually experienced a direct traumatic event, but they're experiencing some kind of acute stress kind of related disorder, then it wouldn't be PTSD. It might be acute stress disorder. It could be some other mental health concern that individual has, but it's not post-traumatic stress because it wouldn't qualify if the person did not experience something similar to what's listed here. That's a requirement in order for that to happen. The other thing I'll say about that, if they do meet criterion A and they have, if they do meet criterion A, they may not go on to develop post-traumatic stress. When we take traumatic events as a whole, when we take them, on average, only about 12, I forget exactly the exact percentage. I think it's 12%, but I'm going to say 12 to 15%. Give me a little leeway, margin of error, so to speak. 12 to 15% that actually go on to develop full criteria to meet criteria for post-traumatic stress. So just because an individual has a traumatic event happen to them does not mean that they are automatically going to experience post-traumatic stress. So that's the other thing to remember. And there are different factors involved in that. And that includes even military combat. All right, so the other things that we want to talk about is regarding life changes, right? And these can be, stressors of their own. And so Holmes and Ray, they developed what was known as the social readjustment rating scale. And what they did was they listed like 43 life events, and we're actually going to look at it here in a second. I did post in Canvas the link, but I'm actually about to show you guys the link, and we're just going to kind of do like a little example here of some typical life events that a person might be experiencing. In the past, like what I've done in the classroom is, we would kind of do this as a group. I would ask for a volunteer, but I'm not going to do that tonight. I'm just going to kind of run through it here, and we can talk about some of the items. The other reason why I don't want to ask for a volunteer is because, it could be stressful as well, and I want to kind of avoid that. But But they did this study, and it was in the 1960s, and based on that, they assigned what was called life-changing units, right? From 11, let me turn on my laser pointer so you can see where I am, from 11 to 100. And the highest score was the death of a spouse. So if a person experienced the death of a spouse, right there, that was automatically a score of 100, which is the highest that you can reach. And so let me show you that that rating scale, and we'll run through it here real quick. Okay, so this is the link that I told you guys I posted, and it's at www.mindtools.com. But if you go into Canvas, you can click on it. You can do this for yourself. But this is known as the stress scale. And so let's just kind of go through it. And basically what a person does if they want to rate their themselves, one thing I want to point out is that these items had to have occurred in the past year. I'm trying to think where that instruction is. Just want to make sure. No, it doesn't really. It doesn't really say, it might say up higher. But this would be within the past year. So did I experience the death of a spouse in the past year? If I experienced it 3 years ago, I would not choose yes, I would choose no, right? Did I experience divorce in the past year or marital separation in the past year? And you'll see that it's assigned different scores. So 100, 73, 65. Did I go to jail? So actually, here's what I'm going to do. I'm going to act like maybe one of my clients, right? So if one of my clients was doing this, most of the time, they could all say, yes, I went to jail in the past year. Or yes, my wife or husband left me in the past year because of my criminal activity and my drug use. Let's go down here. Let's see, marriage. I was fired from my job because I couldn't stop smoking meth. Oh, sexual difficulties, since I mentioned meth. After a while, meth can cause sexual difficulties. Let's see. Maybe my friend overdosed and passed away, item number 17. Let's see here. Trouble with in-laws. Let's see, go down. See if there's anything else. Change in residence. I became homeless. Change in recreation, because I'm doing so much drugs, I stopped doing the things that I enjoy, which is a criteria, by the way, for substance use disorder. Criterion number 7. Changing in sleeping habits. I'll leave that alone. Change in eating habits, vacation. And notice Christmas is on here. Christmas can be listed as stressful. And then minor violations of the law. I'm just going to give that person that as well, right? So we've checked all of these boxes, all of the yeses that apply within the past year. And let's see what this person scores. Calculate my total. It's calculating. And my fictitious client has no, I don't want to share on Facebook or LinkedIn, but my fictitious client has a score of 301. What do you guys think that means? Is that good, bad, different? What do you guys think?
I think that's bad. Need some help.
You could need some help, right? So let's look and see what it says. And you would be correct. So at 301, this individual has a high or very high risk of becoming ill in the near future. So this is something else to think of. And I decided to do a hypothetical client, again, because this is the types of clients that I'm working with. And these are things that I have to keep in mind with my clients. Coming into treatment is stressful, right? The change in their activities, being on probation, all of that stuff. And so, you know, we we want to monitor that person's health. We send them and get them a physical because they haven't been taking care of themselves. As one example, we do mental health screenings. We do, behavioral health assessments. Biopsychosocials is basically what that is. And all of this is designed to gather information so that we can help them get linked to sources. But yes, 301 would be a very high score. All right, let's see. Yes, some people were chatting in saying, yes, that's bad. So this is the stress rating scale. And, you might want to take it yourself on your own time, just to see where you sit. Oh, I didn't really go over the scores too well. So a score of 11, which is the lowest score you can have, which is minor violations of the law, you only have low to moderate chance of becoming ill in the near future. So generally pretty good. A score of 150 to 299. Okay, so now you're at moderate risk, and definitely might want to go, okay, what is it that I need to address, change? What can I do? And then of course at 300, that's the alarm phase. Probably need to be really making some changes. And so that was the social readjustment scale. Does anybody have any questions or comments, or has anybody ever done this particular scale before?
No, but I feel like we should.
Yeah. And as college students, like I said, you guys got a lot going on. You're juggling jobs, family, like I said earlier, 16 weeks worth of work crammed into 1 week. Like we do 2 chapters a week in the summer. Whereas in the fall, my students, I got 2 classes already lined up. They're going to do 1 chapter a week. It's going to be a lot easier for them to manage, right? Yeah. All right, got some chats coming in. Let's see. The link has been posted in the chapter 14 module located in Canvas. So you guys do have access to it. And then another question, I wonder what living through the pandemic would count as. That's a really good question. My bet is you might be able to identify specific topics that are already there that that might relate to being in the pandemic, right? So changes in sleep, changes in jobs, whether you still have a job or not, as an example. So you might have to kind of like link up some things, but that's a great question because pandemic is not listed on there, is it? Of course, pandemic, it's a once in 100 year, once in a century thing. At least I hope that we're not going to experience that again anytime soon. All right. All right, let's go ahead and it is 1900 hours or 7 p.m. Let's go ahead and take our break and come back at 1920 or 7:20, whichever way you prefer to say it. All right, so we're back from our break, and when we left off, we were about to talk about hassles. So, we've been talking about stressors, and we've been talking about, acute versus chronic, and now we're moving into hassles, which are minor irritations, right? They're annoyances. They're things we deal with all the time, right? For instance, traffic. That is one thing about teaching from home, or you guys learning from home is you're not having to deal with going to City College, parking, etc., right? So you're not dealing with the traffic. So you're missing out on that irritation and annoyance. But I'm sure that there are other irritations and annoyances, other hassles that have come up as a result of the change in how we're doing things, at least for the time being. The things with daily hassles is, they can build up. So, one hassle every once in a while is probably not going to leave us feeling very stressed, but hassle after hassle after hassle, right? Day after day after day, that's going to build up. And it's the frequency of those daily hassles that's really a better predictor of our physical and psychological health. And when we think of also with the life change units, right? So we've already talked about daily commutes, whether you're public transportation, that can be, waiting for the bus, or the bus shows up 1 minute early, and you're on time and they're gone. That's never happened to me, but I'm kidding, it has. But that would be an example of a hassle. That happened all the time. That would be that would build up for me. And then with other stressors, right? So there's high stress occupations, difficult, demanding, unsafe work conditions, job strain, right? Where the work situation combines, these excessive job demands with the workload, right? And there's little discretion in making decisions, or the individual doesn't really feel like they have much control over their job. If you remember from last week when we were talking about INO psychology, right? Industrial and organizational psychology, this is some of what was being studied by INO psychologists. And job burnout, that general sense of exhaustion, right? So if you think about that, say general adaptation syndrome there, right? In the exhaustion phase, this is where burnout happens. People get cynical when they're in job burnout, etc. And this frequently occurs among people in human service jobs. Exactly what we were talking about a little bit ago, right? For those of you that are wanting to become, counselors or social workers, or licensed clinicians, or some kind of in the helping field, this is where you're at higher risk for job burnout, just because of the type of job that it is. So, and I've been doing this for a long time, and I've had friends that have burned out, and they've gone on and they're like, you know what, I can't do this job anymore, and they leave. Some really good too, but this is what you have to worry about. And then close relationships, right? Relationships with friends and family can be a source of stress. Excuse me, sorry. Adverse exchanges or conflicts, AKA arguments, right? Lack of emotional support, lack of reciprocity. Remember, we talked about that as well in the previous chapter. So all of these things in close relationships can be sources of stress. So now we're going to move in and we're going to talk about stress and illness. And but before we do, I just kind of want to poll the class here for a second. Let me see. How do I want to? No, you know what? Never mind. Not going to do that. So we're going to move in and talk about stress and illness and different effects on like the cardiovascular system. We're going to talk about personality types. What kind of personality types come to mind when you guys hear that? And maybe you already know because you've done your reading, been working on your homework, but what do you guys think? What are we talking about here? Personality types. There's a famous one, probably everybody's heard of.
Like a type A.
Yes, type A personalities. Yeah. And we're going to talk about type A personality. We're going to talk about type B personality. Yeah. So cool. Very good. All right, so let's talk about those psychophysiological disorders. And, these are, this is, again, caused by chronic stress. And I feel like I'm repeating myself over and over and over again when it comes to this. But it leads to wear and tear on the body, right? Sustained high blood pressure, leading to heart attack or heart failure. Continuous exposure to cortisol weakens the immune system. And we'll talk about how it weakens the immune system in a slide or two, because it has a direct impact on the immune system. And some of the disorders that people experience as a result of this are like tension headaches, asthma, acne. It's funny. One of the professors that I work with at City College, I had like this little breakout, and she goes, "Are you experiencing a lot of stress?" Right? It's because we pick up on things like that because we know about these things, and it's kind of funny. Eczema, hypertension, which is high blood pressure, IBS, irritable bowel syndrome. Any person that has like IBS, stress is going to make that much worse. Coronary heart disease. These are all psychophysiological disorders. And they're called that because what happens is these disorders are made worse by stress and emotional factors.
Professor,
Yes.
one of my friend got those white spot on his skins due to his stress. I don't know what is the term that he got it, but I don't know, you've seen that too?
Yeah, I do not know I know what you're talking about. I don't know what it's called.
Yeah, he was saying due to the level of stress that he got it.
Yeah. So it could definitely, it has physiological effects, doesn't it? Makes us feel run down. Like I said, we're in a couple of more slides here. I think it's coming up. We're going to look at, earlier I was talking about the common cold or flu. People that are experiencing chronic stress are more likely to get sick than those who don't. And we'll see that coming up. So some immune system issues that come up, right? So there's autoimmune disease. And that's basically where your immune system is mistaking your body's own healthy cells and attacking them because it thinks that they are invaders, right? So your body is literally attacking itself. And then the other thing that happens is immunosuppression. And that's, sorry, lost my train of thought. But that's basically where your immune system is not as effective because of stress. So in autoimmune disease, your immune system is working overtime. It's doing the opposite, right? It's attacking healthy tissue. In immunosuppression, when that's happening, your immune system is just weaker. It's not doing its job. And then there's neuroimmunology, right? Which is the field that studies how psychological factors influence the immune system and immune system functioning. So one of the things, and we're going to talk about, well, it's coming up in another slide here. I want to jump ahead. But studies show that the immune system can be classically conditioned. So remember classical conditioning? That your immune system can be classically conditioned, leading to the idea that it can alter immunity, which is very interesting, isn't that? So one of the ways that the immune system is weakened is by the hormones that are released into your blood inhibit the production of lymphocytes. And those are the white blood cells that are floating around that are very important to your immune response. So if that is being inhibited, they're not being produced at its normal number, in other words, it's out of homeostasis, then you're more susceptible to illness. And I do believe you will want to remember, oops, I forgot I didn't have my laser pointer on. You will want to remember how the immune system is weakened, right?
So it's those hormones that inhibits the production of lymphocytes. All right. So this is, oh yeah, this is the slide that I was talking about. So they were talking about, so they did this study of 276 healthy volunteers. And after the interview, they actually basically infected them with the cold virus, right? And here's what the study showed, right? So they interviewed them to see what was going on in their life, right? Determined the amount of stress they were having, and then infected them with the cold virus. And as you can see from the chart, I'm going to turn on my laser pointer, that the chart measures out 3 durations of chronic stress, right? So greater than or equal to 1 month, greater than or equal to 3 months, greater than or equal to 6 months. Or less, I'm sorry, less than or equal to, I always get that backwards. So you see the blue is blue or purple, however it's showing up on your screen. It's kind of an odd color. Those individuals that reported no chronic stressors, yes, some of them got sick, at about 35% of those people got sick. Of the people that reported some kind of chronic stress, you'll notice half of them got sick. And then with 3 months or 6 months, actually it looks like 3 months is a little bit higher, interesting, but you'll notice that they're higher than the 1 month. And so basically what that tells us is that there is definitely a relationship between stress and illness. And then here's another interesting study that they've done, and this is on aging. You know how some people will make the comment about, stress gives me gray hair, or somebody else earlier made a comment about hair falling out. People get wrinkles, right? They show age more as a result of stress. And what they have, excuse me, what research has suggested is that stress can shorten the telomeres. And what those are segments of DNA that are located on the end of your chromosomes that kind of protect the ends of the chromosomes, right? So what they've noticed is that if the telomeres are shortened, then cell division is blocked or inhibited in some way. And that leads to more rapid aging. So more stress, shortened telomeres, inhibited cell division, and now you are looking older. So the graph here basically shows the telomeres are shorter in adults who experience more trauma as children, which is also very interesting, right? So this is children or adults who, as a child, they either experienced no, hold on 1 second, my laser pointer isn't on, no traumatic experience, one traumatic experience, or more than one traumatic experience, right? So, so some interesting studies on aging there. All right. Now talking about cardiovascular disorders, and again, this is kind of a repeat as well. It's actually been woven throughout this entire presentation. Heart disease is definitely a major issue when it comes to hypertension and stress. And then hypertension, basically that's a fancy word for high blood pressure. And again, those job stressors, stressors include job strain, marital conflict, natural disaster, and it's basically forces the heart to pump harder, increasing physical strain on the heart. And what's interesting is there's no symptoms. Most people don't know that they have high blood pressure unless they go to the doctor and regularly have their their blood pressure checked, right? This can lead to heart attack, stroke, heart failure, kidney failure, blindness, and also both of these have been linked to negative affectivity. So in other words, a person's in a has a tendency to experience distressed emotional states involving anger, contempt, disgust. You might call them grumpy, right? They also might be fear, shame-based, guilty, experience guilt and shame, nervousness, anxiety, those kinds of symptoms. So heart attack, between males and females, there are some differences. And what's interesting is that many times women might be experiencing a heart attack and they might not realize that that's what they're having. But for men, they experience lightheadedness, perspiration, stomach pain, shortness of breath. And for women, they're experiencing dizziness, some anxiety, back and neck pain. So you can see already there are gender differences between the symptoms. Some are the same and some are different. Shortness of breath would be the same. Dizziness and lightheadedness. Yeah, I'm not sure exactly what they mean, but every time I see this, I always think I kind of equate the two. But she's experiencing anxiety. He doesn't seem to be. Nausea and vomiting, she would experience. So it's kind of important for you to recognize symptoms of a heart attack, because the sooner you recognize that you're experiencing that, the sooner you can get help, which could be life-saving. All right, type A, type B. Any type A's in here that want to admit it? Just kidding, you don't have to admit it. I will tell you, I tend to be type A. And type B is, well, type A, a type A personality tends to be extremely competitive. They're intensely driven. They can be impatient, rushed, they can be hostile. And of course, there's going to be varying degrees of that. So how they discovered, actually, it was Friedman and Rosenman. They were doctors, and they discovered that people were prone to heart disease. They had the tendency to think, feel, and act differently than those who don't. And so the story goes that they had to have their, the upholstery in their waiting room repaired quite often. And so that's how they kind of came on this. What they found was the upholsterer made the comment, it's like, so, what kind of patients do you have here? Because, the edge of the, where you sit down, you put your arm rests right at the front was frayed. The edges of the seat, because people were sitting on the edge of their seats. And what they discovered was that a lot of their heart patients were all exhibiting all of these same types of characteristics. And so that's how they started labeling them type A, type B. Type B personalities tend to be more relaxed. They're more laid back. They're more easygoing, which, just to make a little joke here, type B people can drive type A people nuts, right? Or cause them hassles, I should say, right? They can be a little irritating because the type A is highly competitive. They want things done. They're working with a type B person. Type B person's like, yeah, it's okay, we're going to get it done. And there isn't the same competitive, isn't the same drive. And by the way, that doesn't make a type B person any more or less productive. I'm not trying to say that. But one of the most important factors in the developing of heart disease, actually the most important, I think, is the anger and the hostility dimension of type A. So you might have a type A person, and they might not be experiencing as much anger or hostility, but if they are definitely going to well, how do I say this? They are definitely at higher risk for heart problems because of that anger and that hostility dimension of their behavior. And then individuals that indicated they responded to pressure with anger were 6 times more likely than those who indicated less anger to have a heart attack by age 55. Here's the other thing that I kind of want to talk about when it comes to the anger and hostility, right? Is that an individual that is experiencing anger and hostility, basically they are at high risk, as I said before, for these heart issues. And what's interesting is one of the theories behind this is the I shouldn't say theory, it's a model of hostility for predicting social interactions. So you see here you have 2 individuals, and turn on my laser pointer. And so what you have here, here's the hostile person, thoughts, anger, mistrust, devalues others. So that's how this person is. So the hostile person's behavior, they tend to be hostile, confrontational, defensive, they're aggressive, right? So in this case, she's being that way with him. He's like, wait a minute. He's surprised by it. He becomes defensive. He wants to avoid it. And then the transactional cycle is that the reinforcement of the hostile behavior. So the long and short of it is she doesn't like people, basically. She's hostile. He responds to the hostility with probably his own hostile or defensiveness, which then reaffirms what she believes in the first place. So it becomes a very vicious cycle. So her own beliefs, and in this case, her own beliefs, and the way she treated somebody else evoked a response that confirmed her own beliefs, if that makes sense. And so it just goes round and round and round. So she's living in this perpetual cycle. That makes sense. I want to make sure I didn't, I know sometimes I get tongue-tied. All right. And then we have depression and the heart. So with depression, this is men and women here, and heart attacks per 1,000 on this chart. So you'll see that with men, well, research suggests that the relationship exists between depression and heart disease. And so people that are diagnosed with depression as children have been found to be more likely to be obese, they smoke, they're less physically active, and as they get older, they are living an unhealthy lifestyle and increasing their chances for heart disease. So basically what this chart is showing is the incidence of heart attacks among men and women by depression. So you see that men are having quite a lot. So let's see. So here we have what we got. We'll say about 3,000 or 3 per 1,000 people, I should say. And then here for men, it's 8 per 1,000. Then it increases. What is that? 11 per 1,000. Drops a little bit here and then increases back up to 15 men per 1,000 men that's experiencing this. And then asthma. So asthma is a, chronic disease, blocks the airways. Well, they become inflamed, they become narrowed, makes it difficult for people to breathe, shortness of breath. And so some of the studies show that people with asthma will experience asthma-like symptoms if they expect to experience the symptoms. And this is an interesting thing about how powerful the mind is, right? So these are just some psychological factors. And then people with asthma report and display a high level of negative emotions, for instance, anxiety. And that asthma attacks are also linked with periods of high emotionality. So the more anxiety they're experiencing, or the more negative affectivity that they're experiencing, more likely that they are going to experience an asthma attack. And then, of course, exposure to stressful experiences has been linked to the development of asthma throughout the lifespan. Hold on one second. Let me turn off my laser pointer. Chat, sorry. Okay, no worries. I got your message, Teresa, you're fine. All right. So then earlier, Betty was talking about some coping styles, some coping things that she likes to do. And we'll talk about those in just a second. I think one of it was music. I can't remember everything that you typed. And of course, now in the chat, it's probably way up there. I'd have to go search for it.
Yeah.
But we'll hit up again. Oh, unless you want to talk now. What were some of the things that you were talking about?
I like to do cooking, just keep my hands busy and my brain, and try to put some music like jazz or instrumental music.
Yeah, yeah. So some distraction techniques, right?
Yeah.
Or alternative activity that kind of takes you away from the stressful situation. Yeah. So that's some good stuff there. So we're going to talk about some different coping styles that we're going to look at actually right now. So problem-focused coping is when the individual actually attempts to alter the problem that is causing them to experience the stress. So in other words, here's the problem and I need to fix that problem. And if I fix that problem, it's going to take care of my stress. So that involves identifying the problem. It involves looking at different solutions. What are my options here? Also weighing the costs and the benefits of the solutions, and then deciding which alternative is the best route to go. And so that is designed to proactively address the problem. People are more likely to do this when they believe that the stressor, that they have some control over the stressor. So they have some impact. They can influence it in some way. Emotion-focused coping, this is designed to engage in efforts to reduce the negative emotions associated with the stress. So it doesn't really attack the problem or the stressor itself. What it's designed to do is to alleviate that negative affective state. So I'm feeling sad. I don't want to feel sad. I'm going to do something different. And oftentimes what this can include is avoiding, minimizing, or distancing themselves from the problem, comparing themselves positively with others, or seeking something positive and a negative effect. In other words, looking at the bright side or the silver lining. The issue with this is that it treats the symptoms of the stress and not the cause. And then, and of course, why would you do that? Mainly because if you don't feel like you have any control over the stressor, then the only thing you have control over is what you can do to manage your emotions around it. So, for example, you are stressed because you are failing a class, right? And if you were going to attack it from a problem-focused approach, you'd be studying more, you would find a tutor, you would come to the professor's office hours, you would reach out in some way. In other words, you would be proactively and directly addressing the workload or the failing of the workload in the class. If you were emotion focused, you might avoid that altogether. No, I really don't want to talk about this. I'm going to go watch a movie, or I'm going to go play games, or I'm going to distract myself in some way. And earlier, when I was talking about stressors, right, when we were doing the that stress scale, right, with the life change units, one of the comments that I made was regarding how some individuals with substance use disorders, right, they're usually using an emotion focused approach. But instead of watching a movie or playing some games, they're actually engaging in, some substance use disorder, right? To alter their state of mind, right? To change the way they're thinking about it. And it's what I call, when it comes to substance use disorders, that's the ultimate form of avoidance, right? The thing with avoiding this stressor is, whereas you might temporarily relieve the negative affective state, if you're not addressing the stress directly, then you may not be learning any coping skills through that, or you may not be solving the problem, and it might be solvable. And this is why we were also talking about coping skills earlier. And thank you, Betty, for sharing what you shared. So when it comes to stress, we were talking about control a little bit. And so now we want to talk about, like, what is perceived control? And, this is our beliefs about our own personal capacity to exert influence. Remember the term self-efficacy, right? That we talked about in previous chapters. And that's a person's ability to believe that they can handle a particular situation, that they have the tools, the means available to them. And this has, major implications for health and happiness. A person that is able to believe that they can exert influence over outcomes, right? They're going to have better outcomes, right? So greater personal control is associated with better physical and mental health, greater psychological well-being, and lower reactivity to stressors. One of the things I often tell my clients is, there's a difference between responding and reacting. Responding usually involves, more thought, the weighing of the pros and cons, like was or cost benefit analysis, like we talked about on the other side, looking at the stressor itself. How can I achieve this, right? Or how can I exert influence over this? As opposed to reacting, that's like always running around putting out fires. That's why it's better to be proactive than reactive. And all of that can be tied into a person's perceived control. And the word perceived is kind of important here too, because remember, sometimes our perceptions might be an error. And so stress can, remember the cognitive issues that can come along with stress. We don't think clearly. And if we're not thinking clearly, we could be misjudging our ability to handle a particular situation. Here's another thing that's come up, and I've actually seen this a lot over the years in working with others, with clients, is this idea of learned helplessness. And learned helplessness is, it's an acquired belief. It's something that a person learns and actually believes, but even when it's not true, they don't recognize that it's not true, that they don't have power at this point. So this came from Seligman, and he was doing experiments with dogs, and actually he started off with like classical conditioning experiments. And here we are talking about dogs and classical conditioning. Remember from the learning chapter, and what he learned about the learned helplessness was that if a dog, subjected to electric shock, right? So we're looking at this box here. I'm actually going to show you a video here in a second, but I wanted to show you this box, right? So the dog can get shocked on one side and not shocked on the other. And you'll notice that there is like a half wall. The dog can get over it. Well, in the first part of the experiment, the dog was not able to escape, was able to escape the shock, right? So he would get the shock, he would jump over the wall, and he wouldn't be shocked, right? So he would respond in that way. When the dog was put into a position where they couldn't escape the shock, and by the way, these are minor shocks. But when they got into a position where they didn't believe they could escape the shocks, they didn't even try. And so this is how his model, his theory of how people, because this happens with humans, right? After a while, if I'm doing something and I keep getting the same result, like this isn't working, this isn't working, this isn't working. After a while, I just stop trying. Even if the answer appears obvious to everyone else, I just stop trying. And so that's learned helplessness. Let me turn off my laser pointer. We'll look at the video here. Oh, sorry, chat come in. Look at that real quick. I just changed that the homework 12. When I went in and looked at it earlier, by the way, I had changed one date to make it extended through tomorrow, but I forgot to change the due date. And then I realized it, and I just went back during break and changed it. So it should say August 5th by 11:59 for both due and availability. And if it doesn't, send me an email after class, and I'll fix that. All right, let's look at learned helplessness.
In 1965, Martin Seligman and his colleagues were doing research on classical conditioning, or the process by which an animal or human associates one thing with another. In the case of Seligman's experiment, he would ring a bell and then give a light shock to a dog. After a number of times, the dog reacted to the shock even before it happened. As soon as the dog heard the bell, he reacted as though he'd already been shocked. But then, something unexpected happened. Seligman put each dog into a large crate that was divided down the middle with a low fence. The dog could see and jump over the fence if necessary. The floor on one side of the fence was electrified, but not on the other side of the fence. Seligman put the dog on the electrified side and administered a light shock. He expected the dog to jump to the non-shocking side of the fence. Instead, the dogs lay down. It was as though they had learned from the first part of the experiment that there was nothing that they could do to avoid the shocks, so they gave up in the second part of the experiment. Seligman described their condition as learned helplessness, or not trying to get out of a negative situation because the past has taught you that you are helpless. After the dogs didn't jump the fence to escape the shock, Seligman tried the second part of his experiment on dogs that had not been through the classical conditioning part of the experiment. The dogs that had not been previously exposed to the shocks quickly jumped over the fence to escape the shocks. This told Seligman that the dogs who lay down and acted helpless had actually learned that helplessness from the first part of his experiment. What does that have to do with humans? At first, Seligman wasn't completely sure, But further research has shown that the way people view the negative events that happen to them can have an impact on whether they feel helpless or not. Let's look at an example. Imagine that you just failed a math test. There are several things that you could say were the reason for that. I'm stupid. I didn't study hard enough. The test was too hard. Each of those reasons can be seen as a different type of attribution. An attribution is the factor that a person blames for the outcome of a situation. Attributions can be made for both positive and negative events. Psychologists have discovered that there are specific types of attributions that cause learned helplessness. The attributions most likely to cause learned helplessness are internal, stable, and global. An internal attribution is any attribution that gives the cause of an event as something to do with the person as opposed to something in the outside world. For example, if you believe you failed a test because you're stupid, that's an internal attribution. Compare that to believing that the test was hard. That's an external attribution. You're blaming the test, which is outside of your control. A stable attribution is one that doesn't change over time or across situations. For example, believing that you failed because you're stupid is a stable attribution. The fact that you're stupid won't change depending on the situation. Compare that to believing that you failed because you didn't study enough. That's not a stable attribution, because next time you can change that and study more. Finally, a global attribution is the belief that the factors affecting the outcome applies to a large number of situations, not just one of them. For example, believing you failed a test because you're stupid is a global attribution because it is true in that class and in many others. However, if you believe that you failed a test because you're bad at that particular subject, it is specific. Just because you failed the math test doesn't mean that you'd fail an English test. As we said before, learned helplessness is most likely to be caused by attributions that are internal, stable, and global. In the example above, the attribution most likely to contribute to learned helplessness is the belief that you failed because you're stupid. Of course, a single test is probably not going to cause learned helplessness, but many studies have been done showing the effect of negative events over time. For example, one study showed that children who regularly did badly in math became convinced that they were bad at math and that there was nothing they could do. The resulting learned helplessness meant that they stopped trying to do well in math. It became a self-fulfilling prophecy where they gave up and, as a result, continued to struggle in math. Another study looked at learned helplessness in college freshmen. It's believed that many freshmen struggle academically because they make attributions that lead to learned helplessness. To combat this, researchers randomly selected freshmen to receive instruction on how things like intelligence and success change over time. The result? Those freshmen who received the instruction had less academic issues than the freshmen who did not. They displayed fewer symptoms of learned helplessness. In addition to these studies, there have been many studies showing how learned helplessness can lead to depression. Learned helplessness also contributes to raising stress levels, reducing the ability of a person to learn new things, and decreasing a person's effort. This makes sense. If you don't think what you do will help, you're less likely to try. Learned helplessness occurs when people or animals feel helpless to avoid negative situations. Martin Seligman first observed learned helplessness when he was doing experiments on dogs. He noticed that the dogs didn't try to escape the shocks if they had been conditioned to believe that they couldn't escape. Other psychologists have shown that learned helplessness is most likely to occur if a person makes global, stable, and internal attributions to negative events. Learned helplessness has many effects. It can cause depression and high stress, and can decrease effort and the ability to learn new things.
All right. And hold on one second. Got it. I got to thank you. And you're welcome. All right. So any questions on learned helplessness? Actually, I like that video because I like the way she starts it off, goes through it, and then wraps it back up. All right. Let's see. So The other thing that's important for managing stress, coping with stress, is having that social support, right? The impact of, family and friends, having someone, that sometimes all we need is someone just to listen to us, right? You got a stressful situation going on, and you want to talk about it. You may not be looking for advice. You may not be looking for that. You just want to be heard. And sometimes just being heard is enough. And that would come under the form of like acceptance or emotional comfort, right? It could also include advice giving, could be guidance, could be encouragement, right? Or some kind of tangible assistance that occurs. And then research suggests that also social support actually boosts the immune system and reduces blood pressure. So our interactions with, with other individuals, it has a good impact on our health. Remember, we are social creatures. Even regardless of where we are on the introversion extroversion scale, there's still, that need for social support. And then somebody had typed in, I forget who it was before, something about exercise I remember seeing it regarding, stress. And exercise is an excellent way to reduce stress and increase resistance to adverse effects of stress. Another really good technique is meditation and relaxation, right? So, and when it comes to the relaxation response techniques, that actually reduces sympathetic arousal. Remember, sympathetic arousal is what? Fight or flight. It reduces blood pressure, right? And then another item is biofeedback. And this is using electrical equipment to measure a person's involuntary, neuromuscular and autonomic activity, right? So you actually get this feedback to help a person gain a level of voluntary control over these processes. So meditation has been really shown to help a lot too. So then there's different types of meditation that you can engage in. And you'll recall that from the states of consciousness chapter 4, I believe, where it talked about meditation as well. And I believe, we're going to be wrapping up a little earlier than I thought. So this is going to be the last section that we're going to talk about, and that's basically the pursuit of happiness. So what is happiness? What is positive psychology? And then flow. And, when it comes to flow, I usually have you guys do, or have psychology students do a discussion on that. I did not do that this time for you guys. I figure we're wrapping up the semester. You've got enough work to do, so I did not add that assignment. So I did not want to add to your pressure. But let's talk about the elements of happiness. And here's a nice Venn diagram that shows, happiness in the middle, right, of all of these overlapping things, right? So the elements of happiness include what's known as a pleasant life, and that is when you are enjoying your daily pleasures. Meaningful life, which is what you are doing to contribute to the greater good. And then the good life, and that's using your skills for enrichment. And as a result of these three items overlapping, that's where happiness kind of resides, right? As an enduring state of subjective well-being that consists of joy, contentment, positive emotions, plus the sense that your life has meaning and value. So those are described as the elements of happiness. So what kind of daily pleasures do you guys think of when you're thinking about your pleasant life? At least I'm hoping you'll be able to have some examples here.
Drinking a cup of coffee in the morning.
Oh yes, the black elixir of life. Yes, just enjoying your morning coffee. Yeah. What are some other morning? I mean, not morning. Sorry, daily pleasures. What's some other daily pleasures?
Seeing the family healthy. I mean, for me, that's my priority.
Oh, okay. So seeing your family healthy, um, being around them, knowing that they're doing well. Okay.
Yes.
Let's see, and looks like we're getting some chats in there. Eating, yes. Sleeping, yes. Petting my dogs, love that. Exactly. Short, peaceful walks around the block. Yeah, very nice. Yeah, these are all, and I'll bet you if I had given you guys an assignment and had each of you write 5 daily pleasures, we would probably have a pretty substantial list. And there might be some overlap, right? But yes, exactly. What about the meaningful life part? What do you guys think about that? You can type that in the chat. I'll read them off, or you can shout them out. We're still getting pleasant life, sleeping late in the weekends. Yes. Anybody got anything for meaningful life? Volunteer work, yes. Actually, a couple of you, 3 of you. Yes, that's a great example, right? Community involvement. I tell you, well, and I haven't talked about it this semester because it didn't really affect anyone this semester, but I have worked every single election for the past, 13 years as a poll worker. And I love doing that. It's fun, it's meaningful, it has purpose. And I just like doing that. There's a couple more that comes in: picking up trash at the beach, continuing education, yes. Having purpose, yes. Excellent. Yeah. Yeah. And then working, like doing, human service type stuff. Being creative, yes, that's another way. Social work, right? Maybe your career can contribute to your meaningful life. Absolutely. Yeah. And then good life, using skills for enrichment. And actually some of that might be like what some of you guys have already said too. Creativity, I think, would also fall into that as well. So good, yes. And helping others. Oh, my writings. Yes. So those, another form of creativity. Yes, absolutely. Yep. Yep, you guys are great. Nice responses. So how happy are people in general? That's what the question asks, and it's funny. How they figure this out is they do surveys, right? And so here's one survey that they did with residents in over 150 different countries. And what they found was that Denmark has the happiest citizens in the world. Interesting. I've never been to Denmark. Would like to go someday. And then Americans, we here in the United States, ranked as 17th happiest country in which to live. 17th. Now that's not too bad when you think out of 150 countries that were surveyed. But anybody surprised that either we're not higher, or maybe you think we would be lower?
I think if the survey was done today, we'd be much lower.
Possibly. What's interesting about that, just as a little side note, because I also love history. If you know anything about history and the political dramas of the late 1800s, early 1900s, especially in the 1890s. Oh, US politics was nasty back then. And so I look at what's happening today, and yes, it's unpleasant. And I'm like, yeah, but you know what? We've been through this before. It's just nobody's alive around to tell us, oh yeah, we've done this before. Yeah, here we go again. But you might be right. We might be lower. So here's some factors connected with happiness. So there's age, and interesting, life satisfaction usually increases with age. If you think about, and this kind of just reminds me of Erik Erikson and his stages of psychosocial development, right? When you get to be like 65 and you're looking back on your life, you know, you're either having ego, integrity, or despair, right? And a lot of people are very satisfied when they look back, right? Family and social relationships. Married people report being happier than those who are not married. And then there's also the high quality social relationships and strong support networks that correlate with increased happiness. One of the things that we really try to encourage our clients to do when they come into recovery is really build that sober, pro-social, strong social support network, right? To not only help them in their recovery and as they progress, but also, this is what I always tell clients, and I may be wrong in this, but this is just basically how I kind of see it. You really can't chase happiness itself, right? If we go back to that Venn diagram, happiness was in the middle of all of those things. Happiness overall is like a byproduct, right? Of, do I feel like I have purpose? Am I socially connected, right? Those kinds of things. And then another thing that's interesting with happiness is, the old saying, money can't buy happiness. Well, it turns out that's kind of true. So happiness increases with income, but only up to about $75,000. I think I was talking about that during the last chapter too. I couldn't remember if it was 72 or 75. But generally, once you get to 75,000, people over that aren't that much more happier than those, at 75,000 or less. Let's see. Religion. In nations with difficult living conditions, religiosity is also associated with greater well-being, but does not seem to make a difference with favorable living conditions. I will tell you that religiosity or spirituality, depending on how our clients decide to define that for themselves, is also shown to be very supportive with recovery as well, and can increase happiness. And then, of course, culture. People that possess characteristics, values in their culture tend to be happier. So these are some of those factors. And then positive psychology. You can actually, when I was in grad school, we had a whole semester on positive psychology. And what positive psychology basically does is seeks to identify and promote those qualities that lead to greater fulfillment in our lives. It tends to be a very strengths-based approach, a strengths-based client-centered approach to working with clients, right? So we would focus on, their hope and optimism, right? Their capacity for love, their courage, their future mindedness, or what I like to say is, their future orientation or their goal directedness, right? You focus on that. Their talents and creativity, all of that stuff. When we focus on the strengths-based approach, helps them develop the self-efficacy. And I'm talking about with my SUD clients now specifically. And increases the likelihood that they're actually going to engage more and more in pro-social activities and behaviors than going the other way. In other words, they start to build a life for themselves, right? So. And then positive effect and optimism. So positive effects, that pleasurable engagement, kind of we're talking about that on the previous slide as well, includes that greater social connectedness, emotional and practical support. And another thing here too that's really important, and we had kind of talked about some coping previously, but adaptive coping efforts is associated with this. They have lower depression and longevity and favorable physiological functioning, right? So here's the opposite effect, right? So the stress has an adverse effect on the person's health and well-being, whereas positive effect has the opposites, right? Tend to be healthier. And then optimism, that general tendency to look at the bright side of things. There's the silver lining in the cloud. And that's a tendency, that's a person's tendency to expect good things will happen. I'm sure one of you guys knows somebody like this. I'm thinking of a friend of mine who's like that. He's always, I don't care what's going on, he's always able to pull out the good things. And this optimism is also a significant predictor of positive health outcomes. And let's see, we got a chat. Let's see, sorry, I got to catch up. Yes, that's me until I get overwhelmed, says one of your students. Yeah, so, and this is where resiliency and then, having those coping skills, right? So how do I handle things when I get overwhelmed, right? And so if we go back to the positive psychology here for a second, right? If I'm overwhelmed, we might focus on hope and optimism, or courage, right? And courage isn't the absence of fear, it's behavior in spite of the fear, right? So approaching that, creativity, spirituality, there's spirituality again. Yeah. So how do I use these things when I'm overwhelmed to help me cope? And then the last thing, this is where we're going to end tonight. We're going to end with flow. And flow is one of those, I don't know, does anybody here have like a hobby that they just love, or something that they love to do? And when they get into it, that's all there is. They lose themselves in that activity. Anybody here have?
Yes,
Yeah.
I do quilting.
Oh,
Patch-
quilt. Yeah.
Patch and quilts, yes.
Patch and quilt. Yeah. That's, you get into it, you lose track of all time.
Yes.
Yeah.
Oh,
Yeah, exactly. Yeah. Anybody else have a
writing. For me, it's writing. Just I get sometimes I get into my writing and it just I'm gone. I'm lost.
Yeah. And one of the aspects of that is, when people engage in challenging activities that require some skills of knowledge that they possess. So writing, that's a great example, right? So not everybody can be a writer, right? There's lots of skills. There's like I could never write a novel. I'll just be honest, right? I'm kind of a practical thinker, and like, I have creativity you want me to create a form? I can have flow with creating forms and procedures. I can do that, and I can get lost in that. But writing, that would be something totally different, right? Quilting, something totally different. We each have our own talents and things. What kind of stuff do you like to write, if you don't mind sharing?
I used to write feature articles for a couple of magazines.
Nice.
Stories on crime and prison stuff. I did a lot of writing, man. I did a couple of short stories too. I actually started on a novel, but I never finished it. It got too complicated. It was like, yeah, nobody will hear
You never know, you might finish that one day, but that can also be
Yeah.
very therapeutic too.
Yeah.
Yeah, that's
A lot of
awesome.
rewriting, man.
Let's see, and then somebody else put in the chat, working out. Yeah, you can definitely get into a flow there, or doing permanent makeup. Again, that's another form of creativity, isn't it? Yeah, that's awesome. That is awesome. Any last comments? People are like, no, Richard's gonna let us out early tonight. Actually, yeah, so we're gonna finish up. And so that's gonna conclude tonight's lecture on chapter 14. So, well, I'll go ahead and stop the recording and then we'll do some housekeeping.